From the Presidential Palace, Manila, Dateline Malacañang.
Good day, this is Dateline Malacañang, and here are the news. Philippine President Ferdinand R. Marcos Jr. called on the Armed Forces of the Philippines, or AFP, to serve not only as defenders of the nation but also as faithful guardians of public funds, stressing accountability as the military undergoes modernization. President Marcos administered the oath of office to 38 newly promoted AFP generals and flag officers, along with one graduate of the Foreign Pre-Commissioned Training Institutions, or FPCTI, during a ceremony at the Malacañang Palace. In his speech, the President commended the AFP's focus on readiness and modernization while underscoring the importance of integrity in the use of public resources, especially following the signing of the 2026 national budget. He reminded the newly promoted officers that stewardship of public funds is inseparable from their mandate as military leaders. President Marcos also cited the AFP's accomplishments over the past year, noting its role in protecting Philippine waters, responding to calamities, sustaining peace and security, and strengthening international defense partnerships through joint exercises and interoperability initiatives. The President also paid tribute to the families of the officers, acknowledging their sacrifices as a vital source of strength for the military. He concluded by urging the newly promoted officers to uphold the honor of the institution.
Last year, the AFP remained focused on readiness with purpose. We advanced our modernization efforts that support both defense and humanitarian missions. On the local front, you have remained a dependable shield of our communities by protecting our seas, providing assistance during calamities, and sustaining peace-building efforts. Internationally, you represented your country with utmost professionalism through joint exercises and interoperability initiatives. These defense partnerships reinforced our commitments and credibility in the international community. With the signing of the 2026 national budget, I reiterate the government's commitment to uphold the welfare of the women and men who protect our nation. This includes the updated base pay schedule, the increased subsistence allowance of our military and uniformed personnel. More than your role as the protectors of our nation, you must also be among the faithful stewards who guard public resources. Be among those who ensure that every peso translates into capability, preparedness, and integrity. Kayo ang tahimik na haligi at matibay na sandigan ng bawat kawal ng ating sandatahang likas. Kaisa ninyo ako sa panalangin sa kanilang kaligtasan at kapakanan. Lead well, stand your ground, and keep the AFP worthy of its name.
President Ferdinand R. Marcos Jr.
Dateline Malacañang.
Malacañang assured the public that government agencies are on full alert for Friday's Traslasyon 2026, one of the country's largest annual religious gatherings that usually draws millions to Manila streets to join the annual procession of the Black Nazarene. In a media briefing in Malacañang Palace, Press Officer and Communications Undersecretary Attorney Claire Castro said Philippine President Ferdinand R. Marcos Jr. has ordered public safety agencies to keep the event peaceful and orderly.
PNP at DILG tiniyak na puspusan ang preparasyon para sa pista ng Poong Nazareno. Alinsunod sa direktiba ni Pangulong Ferdinand R. Marcos Jr. na panatilihing payapa at makabuluhan ang idaraos na traslasyon, nakaalerto ang puwersa ng PNP, DILG at ibang ahensya ng gobyerno upang siguruhin ang kaligtasan ng mga dadalo sa nasabing kaganapan. Ayon sa tala ng pulisya, aabot sa 18,212 uniformed personnel ang idideploy sa mga lokasyon na pagdarausan ng pista ng Poong Nazareno. Makakaasa sa increased police presence and visibility ang mga debotong lalahok sa traslasyon, lalo na sa 3 major areas. Sa Quirino Grandstand, sa buong ruta ng daraanan ng prosesyon, at sa Quiapo Church na huling destinasyon ng imahe ng Poong Nazareno. Ipinag-utos ni PNP Chief Police Lieutenant General Jose Melencio Nartates Jr. sa mga tropa ng kapulisan na maging alerto, mahinahon at makatao sa pagsiserbisyo sa kapwa Pilipino. Para din sa dagdag seguridad, magpapatupad ng no-fly zones ang PNP malapit sa pagdarausan ng traslasyon habang may cellphone signal jammers din bilang additional preventive measure. Nagpaalala naman ng DILG sa mga lalahok na maging alerto at iwasang magdala ng mga matatalim at nakakasugat na bagay, mga paputok at pyrotechnic devices, mga lalagyang babasagin at iba pang ipinagbabawal na kagamitan. Mahigpit ding ipinagbabawal ang pagdadala ng armas gaya ng baril alinsunod sa ipinapatupad na gun ban sa lungsod ng Maynila. Naway maging matiwasay, ligtas at makabuluhan ang selebrasyon ng Pista ng Poong Nazareno para sa lahat ng deboto.
President Marcos has declared Friday, January 9, a special non-working day in the city of Manila in observance of the Feast of Jesus Nazareno. According to the Philippine National Police or PNP, 18,212 uniformed personnel will be deployed across key locations during the traslasyon. Devotees can expect increased police presence at the Quirino Grandstand along the entire procession route and at Quiapo Church, the final destination of the image of the Black Nazarene. PNP Chief Lieutenant General Jose Melencio Nartates Jr. instructed officers to remain alert, composed, and humane while serving the public. Additional security measures include no-fly zones near the event route and the deployment of cell phone signal jammers as preventive measures. Meanwhile, the Department of the Interior and Local Government or DILG reminded participants to avoid bringing sharp objects, fireworks, glass containers, and firearms in line with the gun ban in the city of Manila. The government said the measures aim to ensure a peaceful, safe, and meaningful traslasyon for millions of devotees.
Dateline Malacañang.
Health Secretary Teodoro Herbosa Wednesday dismissed reports that Philippine President Ferdinand R. Marcos Jr. is preparing to replace him. This following earlier online reports claiming the chief executive is planning his most extensive cabinet shakeup yet, affecting at least 9 officials. Castro earlier said they have not received any official information regarding a possible cabinet revamp, stressing that reports circulating online may simply be rumors. Herbosa said he will continue to serve and fulfill his mandates, especially in implementing the Zero Balance Billing Program and expanding Bagong Urgent Care and Ambulatory Service or BUCAS centers.
There's no truth to that. I think Yusek Claire already said yesterday that there is no revamp of the cabinet. But we in the cabinet all serve at the pleasure of the president. So if ever the president wants to replace me, that is the prerogative of our president. We continue to fulfill all his mandates, zero balance billing, bukas centers, and all this focus on the higher budget is emphasis on health. So I think we will continue to pursue the mandates of the president with emphasis on better health care for all Filipinos.
Secretary Teodoro Herbosa.
Dateline Malacañang.
The Department of Health, or DOH, said a commission on audit or COA report flagging 405 million pesos worth of idle medical equipment was based on 2024 data and does not reflect implementation progress made in 2025. Health Secretary Teodoro Herbosa said the audit observation covered equipment procured in 2024 under the Health Facilities Enhancement Program, or HFEP, and remained idle total unutilized, undelivered, or uninstalled as of end 2024. The audit body earlier said 405.545 pesos, or rather 405.545 million pesos worth of equipment procured by various DOH centers for health development and government hospitals remained unused due to inadequate planning, lack of site readiness, defective parts, delayed procurement actions, and lack of trained personnel to operate the equipment. The health chief disputed claims that the situation stemmed from poor planning, stressing that health projects undergo strict vetting before budget approval. He added that proposals are reviewed by DOH regional directors, the central office, and the Department of Budget and Management, or DBM, before inclusion in the National Expenditure Program. He explained that implementation delays often occur because health facilities projects are executed by different entities, including local government units or LGUs, the Department of Public Works and Highways or DPWH, and DOH regional offices. He also clarified that government spending follows a 2-year budget cycle, allowing continuing appropriations when funds are released late in the year.
This is a COA report of December 31, 2024. So released in 2025. So you have to understand there was a whole year of 2025 to fulfill the implementation of all those programs. So I still have to check if it's still 405 million that has not been installed. I will bet na-install na ang karamihan noon. So take into consideration that when you're reporting that, take the date and time that the COA did the observation. I don't understand when you say there is lack of a structured plan. In government, before you can even request for the budget, you have to have a detailed province-wide investment plan for health. Merong process yan. So I don't know what the auditor means when he say walang lack of plan. Number 2, before it even gets to NEP, binubusisi po yan ng regional director, ng central office ng DOH, ng DBM regional office, ng BM, before it even gets into the budget. So nakaplano po lahat yan. And then eventually, pag na-implement yan, depends who implemented it. Kasi there are many people, hindi lang DOH nag-i-implement po ng ating Health Facilities Enhancement Program. There are 3 agencies that actually implement it. The LGU itself can be the one implementing it. The DPWH can be the one implementing it. The regional office can be the one implementing it. So depending on who is implementing it, there can be some delay. And then there are different contractors. Iba-iba yan. Merong mabagal, merong nag-walk away, merong delay in one part, delay in the construction. Of course, kung na-delay yung construction, hindi mo ma-install yung equipment kasi hindi pa tapos yung facility. So you need to finish the facility or, terminate the contract and get another contractor to finish it. So talagang may problems. Those are actual problems in government governance. Talagang hindi yan masi-zero. That will always happen. And that's why you have officials to run and manage this. So you have to check. So when you report that, my suggestion to you is to look first what has happened to it in the year 2025 because that was a 2024 COA audit observation.
DOH chief said budget utilization has improved significantly, noting that the department returned only around 800 pesos from its 2025 budget compared to about 800 million pesos returned in 2024. Under the Marcos administration, the DOH has received one of the largest budget increases, including record allocations in the 2026 national budget to expand hospital capacity, upgrade facilities, and strengthen universal health care.
Dateline Malacañang.
The Department of Health, or DOH, said Wednesday it is not alarmed by reports of a superflu circulating abroad, but advised Filipinos traveling to temperate countries to take extra precautions, including vaccination. Health Secretary Teodoro Herbosa said the Philippines had already detected 17 cases of the new flu variant last year, but all patients have recovered. He said influenza remains a seasonal and generally self-limiting illness except among high-risk individuals such as the elderly and those with underlying medical conditions. Herbosa explained that flu outbreaks in the United States and the United Kingdom are worsened by winter conditions. In contrast, he said the Philippines' flu season usually coincides with the rainy months. The DOH continues to recommend flu vaccination, especially for high-risk groups, using the Southern Hemisphere influenza vaccine, which already includes protection against circulating influenza A strains. Herbosa said the DOH identified the 17 cases only after reviewing disease surveillance data following announcements from abroad. Asked whether the situation is alarming, Herbosa said it is not, but issued a warning to Filipinos traveling to colder countries. The DOH said it would continue monitoring influenza trends through its surveillance systems as part of routine public health preparedness.
Okay, so flu is a seasonal infectious disease. Actually, we've detected the super flu here. Since we reviewed our epidemiology bureau's surveillance of flu cases, and we've actually detected about August, about 17 cases that were determined to be of the new subclass of the super flu. All of them have recovered. So as you very well know, flu is a self-limiting illness unless meron kang medical condition, may cancer ka, may elderly ka. So we still recommend the use of the flu vaccine. Although yung super flu, yun yung sinasabi nila, it is able to avoid the flu vaccine. So kaya nga mas maraming serious conditions in North America and the UK where there is winter. So malamig na malamig kasi dun ngayon. So mas matindi yung flu cases nila. Our flu season actually is during the rainy season sa Philippines. So iba tayo. We have in our vaccine actually carries that influenza A, the Southern Hemisphere vaccine. It contains that vaccine. So as long as makapagpa-vaccinate yung high risk, if you're a young individual, you get flu, the same precautions, public health precautions. If you're sick, stay at home. If you're infected, you have upper respiratory infection, you should cover your face with a face mask. And then better stay at home and then recover para you don't spread the flu. We only detected that after the review. When that was announced by the US, we found out that in our surveillance of diseases, lumalabas na pala yung flu. This is Metro Manila, no? Metro Manila. But all have recovered. So it's part of, you see, ang flu, madaming variants yan. So we try to detect, there are about 80 plus variants, I think. And what they do with the vaccine is the WHO has this methodology to predict which ones are the most probable. In fact, the vaccine you get for going to North America is different from the vaccine we give here in the Southern Hemisphere, based on predictive models yan. So hindi binibigay lahat ng variants. Only what they predict will be the epidemic for that year. So ganun ang production ng flu. So ang advice namin sa flu talaga is still public health precautions, cover your mouth and nose pag uubo ka. If you're immunocompromised, get the flu vaccine. Yun.
Secretary Teodoro Herbosa.
Dateline Malacañang.
In other news, the Philippine Department of Education, or DepEd, said it seeks to expand the Academic Recovery and Accessible Learning, or ARAL program to benefit 6.7 million learners in public schools nationwide after Philippine President Ferdinand R. Marcos Jr. signed the 2026 General Appropriations Act, which grants a 8.93 billion pesos allocation for the measure. In a statement, DepEd Secretary Sani Angara said it is the first time ARAL will be fully funded. The DepEd aims to tap 440,000 tutors, including DepEd and non-DepEd personnel, for school year 2026 to 2027 to strengthen learning recovery efforts for struggling students and ease the workloads and classroom pressures of public school teachers. Moreover, the ARAL fund will also cover training to support tutors in aligning with literacy standards as well as in the procurement of improved learning materials. The learner tracking mechanism will also be enhanced through the Learner Information System as part of the DepEd's intensified monitoring and evaluation systems. The DepEd said these efforts show the government's shift from short-term recovery activities into permanent remediation efforts to address learning gaps in reading and mathematics in basic education. As of Monday, the agency reported that 3.42 million grades 3 to 6 learners and 1.72 million grades 7 to 10 learners have already moved closer to their grade level proficiency according to the DepEd's middle of school year or MOSY assessments. Reading readiness has improved by an average of 5 points among struggling learners in grades 3 to 6, while learners from grades 7 to 10 recorded gains of 6 to 9 points. In 2025, the DepEd's Aral program catered to about 3 million learners in the country.
Dateline Malacañang.
Department of Social Welfare and Development or DSWD Secretary Rex Gatchalian and the Association of Women Legislators Foundation Incorporated or AWLFI agreed to establish a halfway home for women or Women Crisis Center that will provide a safe, secure, and holistic shelter for women and their dependents experiencing abuse and mental health challenges. The crisis center is being pushed by Pangasinan 4th District Representative Gina De Venecia, Bulacan 4th District Representative Lida Bel Villarica, and Bukidnon 3rd District Representative Audrey Zubiri as part of AWLFI's continuing advocacy to complement and reinforce government-led social welfare and protection programs, particularly those under the DSWD. Envisioned as one-stop shop, the proposed facility will consolidate key social protection and mental health services in a single building, rather than operating through separate facilities. The center seeks to address existing service gaps between the Department of Health or DOH and the DSWD through a coordinated and holistic model of care. Designed as a transitional shelter, the halfway home will provide secure accommodation for women survivors of abuse and their dependents for a period of 6 to 18 months. This extended support recognized the need for time, stability, and comprehensive assistance as survivors recover and reintegrate after leaving abusive environments. The implementation will be under the guidance of the DSWD, DOH, Senate, and congressional spouses. In support of this initiative, a Memorandum of Agreement or MOA will be developed soon to clearly define roles, responsibilities, collaboration, mechanisms for the realization of the project, and the project site.
Dateline Malacañang.
The National Council on Disability Affairs or NCDA is intensifying enhancements to the Unified Persons with Disability or PWD identification system to address gaps as it targets full nationwide implementation within the year. During a Bagong Pilipinas interview, NCDA spokesperson Walter Jason Alava said the Unified PWD ID has improved since its regional pilot testing across Luzon, Visayas, and Mindanao in August 2025. He said early challenges encountered during the pilot phase, particularly in system development, data fields, and encoding, are being addressed through continuous upgrades. To date, Alava said a total of 572 cities and municipalities nationwide have already registered and have been trained under the system since its rollout. The NCDA, he said, aims to expand coverage to more than 1,600 local government units or LGUs to ensure a single, standardized, and verifiable PWD ID nationwide. Meanwhile, Alava said a key feature of the enhanced system is the rollout of physical and digital PWD IDs embedded with quick response or QR codes and radio frequency identification or RFID. This allows real-time 24/7 verification through a portal linked to the Department of Social Welfare and Development, DSWD, replacing the previous manual verification process that relied on calls to issuing offices during office hours. Alava said the absence of a centralized verification system contributed to the proliferation of fake PWD IDs in previous years. Meanwhile, to ensure inclusivity in geographically isolated and disadvantaged areas that do not have internet signals, Alava said a unified PWD ID system now includes an offline function that allows LGUs to encode data without internet access and upload the records once connectivity is restored. He said this is expected to be complemented by the government's free public Wi-Fi program. The NCDA also underscored strong data privacy and security measures, including restricted access, separate encoder and verifier accounts, and limited data fields to protect the sensitive personal information of PWDs. Alava said a push for a unified PWD ID system aims to prevent the proliferation of fake or unverified PWD IDs, which the Senate said caused losses estimated at 88.2 billion pesos and protect the rights and benefit of PWDs, including discounts and other privileges.
Dateline Malacañang.
And that is all for today's Dateline Malacañang for Radyo Pilipinas World Service. This has been Bea Gaza-de Guzman.
From the Presidential Palace, Manila. Dateline Malacañang.